So again, how do we treat that? We treat it with lenses called prism. Prism helps to move the images to realign the eyes. In the examination, it's a very extensive evaluation. Like I said, a normal exam can't pick it up. I spend about 1.5 to 2 hours with the individual doing multiple tests to confirm if there is a misalignment. And when we find a misalignment, which is most often than not, because we do that questionnaire, we do the screening, then we do what's called a prism challenge. So we actually demonstrate that prism in the examiner, we show the patient, and almost always immediately they'll notice some relief of their symptoms. And so we can actually show them, okay, this is what your glasses will look like. The muscles have been working so hard for so long, the muscles are tight for these individuals. And so we do what's called progressive relaxation, because since those muscles are so tight, they're not in their natural state because they've been constantly working. And so when we show them prism, initially they might not accept a large amount of prism. They can't, because it's too much for them to accept. So we show them, we might start off with a small amount, whatever amount that we feel they can tolerate, but also can improve their symptoms. And then we prescribe the glasses, and as the muscles are able to relax, sometimes the symptoms may return, and that's why we have them back for a progress assessment and reevaluate again. And a lot of times we'll find additional prism that is needed, because again, their eyes have been able to finally relax. And that's why I emphasize to the patient that these progress assessments are so important, because that first evaluation is not the end point. We can only correct so much. And that's why usually we'll make a change to the lenses as well. So the first pair of glasses is usually not the final prescription. So the course of treatment is the initial evaluation, which is about 2 hours. And then usually about 1 or 2 progress assessments, depending on the individual and how they're responding and what symptoms they have. And as far as the lenses, on average, it's about 2, sometimes even 3, depending on the individual. So that's usually the course of treatment.